So in the Tarasoff case, there are two questions we can consider. One is concerns Dr. Moore and Cowell Memorial Hospital at UC Berkeley. And the question there is, should they have tried to protect Tarasoff by breaching client confidentiality? Should they have tried to alert Tarasoff or one of her family members? And then, the other option for them would be to not do that, right? To not breach client confidentiality. So they have a choice. They can either try to protect Tarasoff by breaching client confidentiality, or they could maintain client confidentiality and not try to protect Tarasoff. Okay, so that's a choice for Dr. Moore and Cowell Memorial Hospital. But we can also ask whether the California Supreme Court was correct in their ruling. Okay, so the result of the ruling was that counselors are liable for not trying to protect identifiable persons who have been threatened with harm by their clients. I think the wording used in the majority opinion was serious harm. Okay, so that certainly would include threats of killing. Okay, so was that decision correct, or was it a bad one from a moral perspective? Okay, so let's consider the first question first, and then we'll think about the second question. So the first question, should Dr. Moore and Cowell Memorial Hospital have tried to protect Tarasoff? Should they have tried to warn her? Okay. Well, there are potential harms associated with that act, and there are also potential benefits. So potential harms are you have. Let's put it this way. Suppose that Cowell Memorial Hospital tries to protect Tarasoff by attempting to warn her of Podar's threat. And let's suppose it turns out that Podar didn't, in fact, pose a serious threat. So he had thoughts about killing Tarasoff, but really these thoughts were not going to materialize into an actual serious threat. So in that case, trying to protect could lead to erosion of Podar's trust in treatment due to the breach of client confidentiality, could result in stigma toward Podar from university and possibly the wider community, and could contribute to stigma for the mentally ill in general. And then you've got a possible false alarm and stress for Tarasoff. You're basically warning somebody that there's this threat to their life when really there isn't a threat. Now you don't know, okay, but these are just the different possibilities. Okay, so those are some potential harms of trying to protect when in fact Podar doesn't pose a serious threat. On the other hand, suppose that you try to protect and in fact Podar does pose a serious threat, which in this particular case actually he did. Right? Then you've got some benefits, right? You've got the harm to Tarasoff, which is avoided. So that's the kind of flip side of that benefit, is just the flip side of avoiding the harm, right? She gets to live. That's the main benefit. Now, let's suppose that you don't try to protect Tarasoff. Well, then, again, we can look at the potential harms and benefits, right? So suppose that they decide not to protect, and Podar does, in fact, pose a threat, well then you've got serious harm to Tarasoff, and in this case that harm was actualized, so she was killed. You've also got the arrest and imprisonment of Podar, although he was later released and deported back to his home country of India. And once again, you've got the potential for this kind of increased stigma for mentally ill. All right. Suppose you don't try to protect, and it turns out that Podar doesn't, in fact, pose a serious threat. Then you potentially have the continuation of Podar's trust in treatment rather than an erosion of trust. You've potentially avoided some stigma, not just stigma toward Podar as an individual, but also stigma for the mentally ill. And you've avoided the problem of raising a false alarm, right? So it's not clear what you should do. It kind of depends on what your confidence is in each of these possibilities, right? So how seriously do you take Podar's threat? Is it the case that if you think there's even a small chance that Podar's threat is credible, you ought to reach out and try to contact Tarasoff? That's a difficult question. Again, the way that I would try to settle the question is by looking at the potential harms and benefits associated with each action. Protect, don't protect, and then I would try to assign some sort of probabilities to each of these outcomes, and then I would try to engage in a kind of weighing of the different considerations. Right. So here we have a balancing of different reasons. Those reasons, the strength of those reasons, will have to do with both the potential outcomes and the likelihood of those outcomes, or the perceived likelihood of those outcomes from your perspective. Again, you're uncertain, so that makes the question a difficult one. Right? Okay, now let's shift over to the second question, which is whether the Supreme Court made the right decision from a moral perspective. That is also a difficult question. The Supreme Court ruled that the defendant was liable for not trying to contact Tarasoff or a member of Tarasoff's family who could have alerted her to the danger she was in. Okay? So basically now, if you're a counselor and someone tells you, one of your clients tells you that they have thought about killing some person, and that person is identifiable, so it's not just a random person who you can't identify. So you would now be liable if you did nothing to try to protect that person, and your client actually inflicted harm on that person. So under this California Supreme Court ruling, you would now be liable for that. So was that a good decision? Well, you might think that in certain cases, counselors now have an incentive to try to protect other people in the community from serious harm. And that may not seem like such a bad thing. In fact, that might seem like an advancement. That might seem as if the law has gotten better or closer to what morality or what our ethics require. On the other hand, it could lead to harms. So, potential outcome of the Supreme Court's decision is an overcommitment of the mentally ill. One way to protect an identified person, someone who's been threatened, who your patient is threatening to harm is to commit the patient. Okay. But one problem is that it's possible that the number of people who announce that they're thinking about killing someone is much greater than the number of people who announce that they're thinking of killing someone and are actually likely to kill someone, right? Now you, as a counselor, have an incentive to commit someone, even if you think there's only a small probability that they're actually going to carry out their threat, right? The incentive is that you would be liable if in fact they did carry out the threat. So one concern is that the Supreme Court's decision will lead to an overcommitment of mentally ill, where the incentive to commit these people is, as it were, impure. So it comes not from your opinion as a professional counselor, but rather from this incentive that you now have to protect yourself. And that's something that we may not want. And again, another possibility is that this will lead to a kind of erosion of trust in treatment. So, is that true? That's an empirical question, and as far as I know, it has not been adequately studied.